Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Today, we have several guests, all from a great company by the name of TridentCare. If you don't know, TridentCare is the #1 mobile clinical solutions provider nationally. The guests that we have on today are three. We have Jeff Barton. He is the Executive Vice President of Corporate Accounts. We have Everett Patterson. He is the Vice President of Worksite Clinical Solutions. And then we have Lorelei Schmidt. She is the Vice President of TridentCare at Home. Welcome to the program.
Thank you, Tom. A pleasure to be here.
Awesome. So, Jeff, let's start with you. Tell us a little bit about TridentCare that the audience might not know about.
Yeah, Tom, thank you. TridentCare has been in business for over 40 years. And historically, what we've done is provide mobile imaging within the long-term care space. The reason we came into existence was because within the long-term care space, the elderly, the patients within those facilities, previously, many years ago, had to be transported in an ambulance to a hospital to get an imaging done, whether it's an X-ray or an ultrasound. What really came up was the undue stress on certainly the patient themselves, on the family, and certainly the cost to the family, the cost to the facility, the cost to the government. So what happened was companies like ours, we provide mobile solutions, specifically on the imaging side. So what happens now, and has really happened for the last 30, 40 years, is instead of that patient having to be transported to the hospital, we will come perform the exam at their bedside. So the facility calls us, whether it's an X-ray or an ultrasound, we've got techs across 37 states where we'll go into the nursing home, do the exam right at the bedside, providing efficiency and improved clinical care, and then get those results back to the physician within the span of an hour or so. So we've provided over the years incredible efficiencies and improved clinical care to the patient themselves, to the nursing team and the physicians, while also saving the government an awful lot of money so to avoid the cost of transporting these patients to the hospital. That's really how TridentCare came to be. Now, what we're seeing, Tom, as I think we're going to get into in a little bit, is the evolution of healthcare and how that's being delivered. And certainly the pandemic has expedited this, but we are truly seeing an evolution or even a revolution in the way healthcare is being delivered. And we look forward to expounding on that in a few minutes.
Interesting. So, Everett, tell us a little bit more about your efforts in the Worksite Clinical Solutions.
Yeah, sure. So, worksite clinics serve a couple of purposes. They're looking to reduce the cost of delivering healthcare to its employees while also improving the quality of care and services that they deliver. So the role that TridentCare is playing in that regards is related to the imaging services, as imaging is an ideal candidate for reducing and managing employee expense. And, we really think it's about to take center stage, post-pandemic, as companies are beginning to realize that a key diagnostic tool to helping providers make faster clinical decisions is around imaging. And TridentCare can bring those imaging services to the worksite to allow for those providers to make faster clinical decisions while also reducing, unit costs for those employers that provide on-site care.
Interesting. And Lorelei, the same, TridentCare at Home, very interesting. Tell us a little bit more about what's going on in the at-home model.
Sure. Very similarly to what Jeff and Everett had just stated, we are able to provide the same hospital-grade level of diagnostic services, but to a patient's home, be an independent living facility, it could be an assisted living facility, it could be even a private residence. And what we've really seen through the pandemic is not only the shift towards the home, but the increase in acuity clinical level of the patient. We're seeing patients who would normally reside in a SNF for short-term rehab, long-term care, now be treated in the patient's home. With the waiver from Centers for Medicare and Medicaid Services on hospital at home programs, there's now hospital without walls programs where patients are being treated at home. So there's definitely a shift. in that homebound space that we can fill a gap for diagnostic services when needed.
Is it a gap or is it the new norm?
I'm going to say a little bit of both. It is definitely becoming the new norm. The at-home sector for our company is not new. However, what we've seen is an expedited use and want and need from consumers and providers to be able to bring these services to their patients in the home rather than have their patients go out and obtain the services elsewhere.
Interesting. So I'm hearing SNFs, long-term post-acute care facilities, employers, and the home, the physical home of the consumer. So it is really a healthcare anywhere model that Trident embraces. Is that a fair statement, Jeff?
Yeah, it really is, Tom. And I would even add into there, we do service correctional facilities. We service hospitals, post-acute hospitals. So we truly provide the service, as we like to say, wherever the patient is. And what I would like to echo is what Lorelei was referring to there. Is it the new norm as far as healthcare delivery? And I truly believe it is. And part of that, Tom, is getting the education out to the patients, the population across the country. So many of the folks out there don't know that mobile imaging exists. They certainly don't know that TridentCare exists because we've had so much in our history. If you need an x-ray, you're going to go to the hospital to get that done.
Right.
What's really happened is we've seen it certainly in the home health model. The whole delivery is just transforming before our eyes. I think Lorelei was referencing the hospital at home programs where many companies are getting in there. Is part of that. They need imaging. They need a company that is able to provide imaging to these patients, because once you allow a patient to leave that hospital at home to go back to the hospital, it defeats the purpose. And so that's where a company like TridentCare is able to offer these services. So really, it is the new norm. At the same time, it's an education for all involved because it is so new to everyone.
Yeah. I often hear from clients and the industry at large, because of the radio programs like this, that there's only a limited set of things that you can do in the home. And I have come to believe that is just a false position to espouse, because the more and more I engage and talk to folks, innovators like TridentCare, it's realized that the home, and when I say the home, it's any place, whether it's the employer location, the physical home, the SNF, wherever, you can deliver care anywhere. Whether that be imaging, drawing of blood or medical kits, wherever that patient is the setting of care. So Everett, you talked about the employer. Tell us a little bit more. Obviously I'm an employee, but tell us a little bit about what type of services an employer could leverage, and how the employee ultimately engages.
Yeah, sure, Tom. So right now today, the current reality for employers with their clinics are patients are often referred to, or the employees are often referred to a fixed site imaging location, such as a freestanding diagnostic center, a hospital-based facility, or an urgent care facility. And many times these are high cost centers. So, the last place, unless it's an emergency, that employees should be accessing, imaging needs is in a hospital. I think most people would agree that, that's
Sure.
the, high cost center. In addition to that, the employers don't really have visibility to the quality and the market rates for when their employees leave the four walls of the clinic, that what those costs are. So as employers are rapidly accelerating, innovation within their care centers, they're looking for ways to, how do we reduce our unit costs? So how do we make the cost of care lower while also improving healthcare outcomes? So, it's a very fine balancing act between lowering the cost of healthcare and improving the outcomes. So where TridentCare can play a significant role in achieving both is, we're able to bring that high quality digital hospital grade imaging solutions to the care center, reducing exposure for the employees in a hospital setting. Right now with the pandemic, most people probably do not want to be in a hospital setting, unless they need to be there. So we can eliminate some of those environmental risks by bringing our solutions to the care center, or even working with Lorelei, if the employees are still working remote, going to the home setting to support an employer's virtual health or telehealth solution. So, we have a full closed solution where we can actually provide the imaging services on site at a lower cost per unit than going into the community, and also while reducing some of the soft savings with the employees having to leave the job site, travel for a few hours, wait for the imaging to be done, and then maybe it takes a few days for the result to be, transmitted back to the providers within the 4 clinics. With mobile imaging, and we can do an exam and result that read, within 4 hours, from the time that we shoot the exam to resulting the read, allowing those providers within the clinic to make faster clinical decisions.
Very interesting, Everett. So, I got my 84-year-old mother-in-law in my head, and so she's more the consumer, not the employer. But it begs the same question. Typically nationally, the average is, it takes 23 days to ultimately get an appointment with a doctor, or she has a medical issue and she's going back and forth between getting the x-ray and now fighting with the insurance company to get an MRI and things of that nature. But it took her a couple of weeks to get the x-ray in and of itself. So it sounds like not only are you lowering cost and improving outcomes, you're improving the time to service, right?
Correct. So right now, like I said before, some worksite clinic operators will actually make the investment into fixed site imaging, but that's at quite a significant expense, because you've got to hire a radiologist, you've got to hire the technician, the cost of the equipment, the maintenance of the equipment. So from a financial standpoint, that is a drain on the ROI, and you need significant scale to have fixed site imaging within your worksite clinic. For most worksite clinic operators, they don't have that level of scale and utilization coming through their clinic where it makes sense to make that investment. So the alternative is, right, in today's market, is to send them out into the community to get their imaging done. Where we have a really excellent solution is, no, we'll come to you. We'll come to the care center, or we'll go to the home, and we'll deliver those services, at the point of care, whether it be at the work site, a near site center, a shared center, or at the employer's home.
Yeah. So Jeff, Everett talks about lowering the costs, improving outcomes, improving the time to service. It's interesting because from a broader market perspective, we always hear about value-based care, and value-based care is all about taking on risk. It sounds like your service can help physicians and healthcare institutions and reduce costs, provide better quality care without taking on risk. Is that a fair summary?
Yeah, it's more than fair, Tom. And I would also add onto that is it provides an incredible amount of efficiencies as well. In the situation you explained earlier, Tom, quite often with the elderly or whomever needs an exam, you get into logistics as well, right? You have to coordinate a ride to get to the hospital, to get the exam done. There's a lot of waiting around. When we're able to bring the imaging, again, whether it's an x-ray or an ultrasound, to you or to your mother-in-law who may be elderly at the convenience of their own home in a time that works for that individual, that patient, it creates an incredible amount of efficiencies for the patient themselves, for the family, for the physician. And just to clarify one thing to your point, is this is truly hospital-grade equipment. This is state-of-the-art, hospital-based mobile imaging equipment. And so it's one reason why we have been able to provide imaging services within the hospital as well. And to bring this into the home rather than the patient having to go to the hospital certainly provides all the benefits that you just mentioned, Tom, as well as Everett.
Interesting. If you're just tuning in, you're listening to The Virtual Shift. I'm your host, Tom Foley. We have three special guests with us today. We have Jeff Barton, Executive Vice President and Corporate Accounts of TridentCare. We have Everett Patterson, Vice President of Worksite Clinical Solutions. And we have Lorelei Schmidt, Vice President of TridentCare at Home. And we are talking about healthcare anywhere and the distinguishing value that TridentCare brings to the employer, to the healthcare system, SNFs, long-term care facilities, and even the consumer themselves. So, Lorelei, we talk a lot about the imaging side. Are there any additional services that the at-home model brings to the table?
Yes, there are many other services models, laboratory services, phlebotomy services. So instead of going out to a brick and mortar or patient service center of a laboratory, laboratory tests can be obtained at home. Whether that's a blood draw, collecting different types of a urine sample, a COVID test sample for PCR testing, any of that can be done in a home. TridentCare also has a vascular access division, which for patients who are more ill, severely ill, or may even be a cancer patient undergoing chemotherapy at home, those are solutions that can now be delivered in the home. We are actually working with a hospital system, specifically with their oncology department. And during COVID, this whole shift for chemotherapy at home was implemented to keep them out of the hospital, to be able to provide the services that they needed undergoing chemotherapy treatment for 6-8 weeks. And it has been positively successful. The patients love it. It's just a good patient experience all around.
Interesting. It sounds like to me, as I listen to this conversation, TridentCare is really defining the fact or clarifying the fact that the home and the workplace location and or the SNFs is the true setting of care. And you do not have to always go into a larger brick and mortar at the inconvenience of all and at the cost of all to ultimately get a better, less expensive delivery of care model.
That's absolutely fair and correct, Tom. You expressed it very eloquently. Thank you.
So where do you see the market going, Jeff, in the context of, I do think that obviously COVID changed things. I when I go to the dentist's office or in the provider's office, the waiting room is now empty, but everybody's in the parking lot. So, which is fine. But, the whole idea, I think one thing that the COVID taught us was, and why is it that I am bringing everyone that is sick into a waiting room that has the cough and cold. That was actually right on point there, Everett. The cough and cold and pink eye and every other contagious thing in the waiting room. But what it did was it said, yeah, we have to fix that problem. But, through the use of virtual care, telehealth, remote patient monitoring, chronic care management, and even remote therapeutic monitoring, coupled with services like TridentCare, that blended model, that virtual care model, seems to be the new norm and validating, frankly, that there is the ability to extend the delivery of care from a brick and mortar facility to wherever you are. That's really where the market's going. Jeff, thoughts on that?
Yeah, no, I fully support that. And I truly do believe that is where the market's going. Lorelei and I have certainly attended some conferences, listened in on conferences where you're seeing an awful lot of money from private equity, from owners flowing into home care. And that can be anything from the hospital at home to home care to home health. That's where all the money is flowing. And in a lot of the studies we read, they're not building more hospitals. If anything, they're cutting back on the beds. They have staffing issues. To your point, Tom, people right now across this country would prefer not to go to hospitals. And that's really the outcome of, one, the pandemic, but also, two, from our culture, right? Amazon was one of the first to say, we will bring service to you. You don't need to go out to wherever you might go. We're going to bring it to you in the comfort and efficiency of your own home. That's where healthcare is headed. And it's not only headed there, it exists now. And what we're seeing is more and more folks, not only patients and physicians, but employers, as they understand that the option is there for healthcare to be brought to you directly, we're starting to see more and more buy-in. And so I completely echo what you're saying, Tom, is I do believe that's the future of healthcare and that it's based in the home.
Yeah, and I think the larger challenge here is that, at least as I see it, and when I engage the market, is that physicians and even health systems, for that matter, aren't aware of the changing models. When I talked about reducing costs and improving care and not having to take on any risk, providers oftentimes don't realize that through the new CPT codes, new billing codes for, again, remote patient monitoring, therapeutic monitoring, and chronic care management, you can enhance the services in which your clinical team provides and generate a lot more revenue and reduce a lot of costs. And that's a benefit to everybody. So, you got, from a doctor's perspective, nothing happens in healthcare unless there's revenue tied to it, unfortunately. But I get it. But, reducing costs, as Everett calls out, and improving care, increasing revenue, those and not taking on any risk seems to be a model that it just simply is not yet embraced. But to your point, is a model that I know TridentCare seems to be expanding on, given the growth that they've seen in a post-COVID world. Thoughts on that?
Yeah, no, agreed on that. One other aspect of that, Tom, is you're starting to see a lot of the payers, the insurance companies as well, start to buy into this. They're starting to understand the dynamic of, selfishly to us, mobile imaging, and starting to work with us in terms of reimbursement. So whereas historically the reimbursement has been based really on, you go to a hospital, you go to an urgent care center, we're now working with all the large payers to get fully reimbursed for this service as well. So there continues to be an education process to all involved, but you're starting to see more and more buy-in from all parties, whether it's the patient, the physician, the employer, the insurance companies. So you're starting to see really what I believe, again, is the evolution in how healthcare will be delivered.
Yeah, I agree. And TridentCare leading the way. Everett, so we only have a couple minutes left. So tell us what employers, if you were talking to a prospect, again, summarize for us the value to the employer side of the equation and what TridentCare brings to the market.
Yeah, sure. To surmise it, TridentCare can bring those imaging services on premise so that the employees do not have to go into the community to access healthcare costs at a higher rate, and also, the downtime for those employees leaving the work site. So, we begin to close some gaps in care that are not really often talked about. So, as a provider writes a script for an employee to get an X-ray, and that employee needs to call that provider, and that appointment is a week from now, now we start to run into some of the compliance, whether does that employee actually go and, fulfill that script with the provider, because now they have to go downtown, get the script, and it's going to take a week. So now you start to have gaps in care because the employee was not compliant. With our services, or any mobile diagnostic provider at that, we can come on premise and deliver those services. So we can deliver our services in one of two ways: in a scheduled format, in that we are there on set days and set times, and we truly become that imaging partner for that employer. Or we can do it on an ad hoc or stat basis, where they need us, we show up and we come. Due to our scale, TridentCare has a national footprint. We are operational in 39 states and licensed in 43 states. So our scale and footprint allow us to cover 99% of the U.S. population, so that we're able to deliver our services in both modalities, whether it be on a scheduled basis, so it's set days and times for employers, or on an ad hoc basis. But, as I look at the future, more and more employers are launching their own clinics because their employees are demanding better engagement, better relationships with their primary care provider. The days of a 5-minute visit with your physician and a 15-minute visit with your nurse, those are, starting to come to an end. Employees, patients are demanding better engagement and better relationships with their provider so you can do whole person care. So that's why you're starting to see the prevalence of worksite clinics popping up all throughout the country. And also, they help to address access to healthcare issues. So as some of these employers are in rural areas, you have access to care issues. There are not enough providers in certain markets to provide the care for employees. So now the employers are getting into the healthcare business, unfortunately for them, but fortunate for them, because a healthier workforce is a better workforce.
Exactly. So, and not just imaging. By the way, you nailed it on the whole addressing the whole person. That is very critical. But when you talk about the employer and diagnostic solutions, I would imagine Lorelei's service even comes into the employer play as well. Is that a fair?
Yeah. So laboratory, yes, to a lesser degree, but yes, we've done a lot of COVID testing. We've got complex laboratories throughout the country that we could. You do your panels, within the lab. Vascular services and oxygen, not so much today. As the environment continues to evolve, there could be a play down the road for some of those services coming into the employer care center. But yes, primarily today, it's really focused around imaging and laboratory services in the employer segment.
So, Lorelei, I'm going to end with you. At home, healthcare anywhere. Tell us what you think is coming in the next year and two relative to how we should be looking at the home.
Looking at the home is the number one place healthcare will be delivered in the United States. I recently just attended a conference last week in Washington, D.C., and it was made very, very clear with investors into this home care segment that this is where patients want to be treated. And I see the acuity level of these patients increasing and getting that same higher acuity level treatment, but at their home. Hospitals, the brick and mortar hospitals will literally be surgical centers and ICU units, intensive care units. And anything less than that will be provided in a patient's home. There's always going to be a need for the skilled nursing facilities, memory care units, just because those patients do need more of the 24/7. But there are a very large amount of the U.S. population turning 65 now on a daily basis. And those patients for many, many years are going to want to stay at home and receive their care at home for the next 20 years. That's where I see this definitively going.
I agree. Virtual care in the short time of COVID has moved from video visits to complete virtualization of the delivery of care model. The point there being is there is a large portion of the care delivery model that can be done any place. It doesn't require a brick and mortar. So looking at when we define virtual care or maybe remote care, bundling telehealth, remote patient monitoring, chronic care management, remote therapeutic monitoring with the services like a TridentCare, it redefines the whole game. I will leave it there. So Jeff, Everett, Lorelei, great discussion. I hope to have the TridentCare team on again in the near future. Thanks again for participating in this radio program. I want to thank the show sponsors, HP. HP Engage Long Lifecycle Products provides the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, GenieMD, providing a modular, scalable, and customizable virtual care platform and clinical services to help providers extend care into the home, increasing access and quality while driving new revenue opportunities. If you missed part of today's episode, you can tune in at the same time, 11 a.m. or 7 p.m. Eastern, throughout the week, and be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.